Good morning, everybody. My name is James White, and I am a clinical advisor here on the SHOPS Plus program at Apt Associates. And I'm here today to talk to you about private sector engagement for health system resilience. A resilient health system is one, by definition, that has the ability to mitigate, adapt to, or recover from shocks and stressor events that challenge the health system through changing circumstances or large sudden events that test even the most well-resourced systems. Ultimately, a resilient health system would be able to ensure an effective response to an emergency or a shock event, like a natural disaster, an epidemic, or so on, but also to ensure that during those emergency times, during those shock events, that they were able to maintain the continuity of existing primary healthcare services and other essential health services. So there are numerous roles for the private sector in health system resilience. They can be contracted short or long term to provide services in times of emergency, so public services can focus on the most emergent issues. Private medical equipment suppliers, manufacturers, transport companies, all of these are critical during an emergency and also for routine supply chain management. Private employers of all shapes and sizes are critical to disseminating information to their employees, to their workforces, to engaging in the communities in which they operate. So to date, there are indeed numerous examples of where private sector actors have contributed to national health system resilience or emergency preparedness efforts. However, literature shows that efforts to engage the private sector have typically been too ad hoc, have come too late, and have often been disconnected or poorly coordinated with broader national response plans. This is not always the case, but typically speaking, the earlier the private sector has been engaged, the better. There's broad recognition from FEMA, CDC, USAID, WHO, and others that what is called the whole community response is needed for health system resilience, as in no sector or agency alone can obviously prepare a health system or a nation for resilience without the involvement of actors across multiple industries and sectors. There remains confusion, though, about the channels, the modalities, the different ways and options in which this engagement can be more systematic. That's what the SHOPS Plus private sector engagement for health system resilience framework is trying to do based on global evidence. Overall, a well-prepared health system is one that involves the public and private sectors as part of a whole community response. And that's aligned with existing health system strengthening efforts, universal healthcare efforts, and other ways to prepare health systems during times of calm for those shock events when they come. So having reviewed significant global evidence for the preparation of this report and framework, two things are very, very clear. One, there remains major distrust between public and private actors that's been limiting discussion about private sector engagement in the humanitarian or health system resilience space. And this is particularly difficult in the chaotic moments following a shock. Trust and planning needs to be built before events occur. The second is that private actors from various industries have been crucial to minimizing the impact of shocks and stressor events. But it's often done, as I mentioned before, too late or ad hoc. It's better to acknowledge the need for whole community responses right from the outset, to engage in a systematic process of identifying problems and the tasks needed to address those problems, and then systematically finding private partners that can fill those roles. To date, that has not truly been accomplished in a lot of settings.